Welcome to today's video. In this video we will share information about early pregnancy signs and symptoms. Are you trying to conceive and wondering whether you could be experiencing any symptoms just a few days past ovulation, DPO? It's not uncommon for women to notice changes in their bodies within a few weeks of ovulation. In this video, we will be discussing the early pregnancy signs and symptoms to watch for post-ovulation, so stay tuned. To understand the early pregnancy signs and symptoms, it's important to understand the basics of the menstrual cycle. The menstrual cycle is a natural process that occurs in women, preparing their bodies for pregnancy each month. It is important for all women to understand their menstrual cycle to maintain good reproductive health and identify any potential problems that may arise. The menstrual cycle has 4 stages: menstruation, follicular phase, ovulation, and luteal phase. Moving on to the days past ovulation, let's take a look at some of the most common symptoms in the first 14 days to know what to watch for. Cramping. The cramping pain can be a sign of implantation that occurs when the fertilized egg attaches to the uterus lining. During ovulation, the cramps could be felt on either side of the lower abdomen, but after ovulation, cramping is felt when the uterus is preparing for the arrival of the fertilized egg. Spotting or light bleeding could occur in the days past ovulation, which is often an early sign of pregnancy. This is because spotting occurs when the fertilized egg implants in the uterus lining, which can cause mild bleeding. However, it could also be a sign of menstrual flow if it occurs around the time of the expected period. Breast changes in the breast could be one of the earliest signs of pregnancy, such as tenderness or swelling, which is caused by hormonal changes in the body. It is common for the breasts to feel heavy, sore or itchy after ovulation, and this is usually due to an increase in progesterone levels. Mood changes in mood, such as irritability, depression or anxiety, could also be a sign of the days past ovulation. These mood changes are usually caused by hormonal fluctuations in the body, which occur during the menstrual cycle. Cervical mucus changes. The changes in cervical mucus can be a sign of ovulation, and they may continue into the days past ovulation. The cervical mucus may become thicker, stickier, and more opaque in the days after ovulation, which can make it difficult for sperm to reach the egg. Fatigue. The days past ovulation may leave you feeling more tired than usual. This is because of the rise in progesterone levels, which can cause fatigue. Nausea is one of the common signs that could indicate pregnancy in the days past ovulation. This is because of the increase in estrogen and progesterone levels that occur in early pregnancy. It is not limited to the morning only and could occur at any time of the day. Body temperature changes. Basal body temperature could increase in the days past ovulation, and it could remain high until the next period. This is due to the increase in progesterone levels, which could cause the body temperature to rise by 0.5 to 1 degree Fahrenheit. Food cravings. Changes in food cravings, such as craving for salty, sweet, or spicy foods, could be a sign of pregnancy in the days past ovulation. The hormones in the body are fluctuating, and they could cause an increase in appetite or a craving for certain foods. Headaches. Changes in hormones levels during the menstrual cycle could cause headaches, especially in the days past ovulation. These headaches may be mild or severe and could be accompanied by other symptoms such as dizziness and fatigue. It is important to note that headaches could also be a symptom of other conditions, such as migraines or tension headaches. Therefore, it is essential to speak with a healthcare provider if headaches are persistent or severe. In conclusion, understanding the signs and symptoms of the days past ovulation can help women identify potential early pregnancy signs. However, it is important to remember that these symptoms are not the same for everyone, and confirmation of pregnancy through a pregnancy test is necessary. By keeping track of their menstrual cycle and understanding the changes that occur during each phase, women can take control of their reproductive health and make informed decisions. If you're trying to conceive, tracking your ovulation and timing intercourse accordingly may increase your chances of getting pregnant. But it's also important to maintain a healthy lifestyle, including a balanced diet, regular exercise, and stress management to optimize your chances of conception and ensure a healthy pregnancy. Remember, if you have concerns about your menstrual cycle or potential pregnancy, it is always best to consult with a healthcare provider who can offer personalized advice and guidance based on your unique needs and circumstances. Thank you for watching. Like, comment, and subscribe.